name's Craig Cohen. This is my 10-minute head-to-toe assessment of a patient with low back pain and intermittent headaches. I'll have the patient enter the room, and you can have a seat right there on the exam table. Can I get your name?
Danielle.
Nice to meet you. Your date of birth?
4/29/81.
And any allergies you might have.
Codeine.
Great. I record and document that all in her file. And I begin by assessing her general survey. So when she came into the room, I would be looking for her mobility, I'd be checking her posture, her skin color, and finally her level of consciousness, her mental alertness. And we begin with her vitals, and what I would do is assess her radial pulse. And while doing that, I'm going to be checking her respiratory rate. Finally, I would take her temperature and do her blood pressure. And I begin by doing inspection. I'd start with her hand. And whenever we do inspection of the skin, whether it be her hand, face, or any other body part, we're going to be looking for temperature, tone, tuber, color, any scars, lesions, evidence of trauma. And I'm going to look for all that throughout her whole body as we move through this exam. And also what I'm going to be looking for when I'm looking at her hand is I'm going to be moving towards her nails here. I'm looking for color, consistency, and contour. And then I'm going to move towards her head and scalp. And when I'm looking at her head and scalp, I'm going to be palpating and identifying any lesions, any areas of hair loss, any tenderness throughout her scalp and head. And then what I'm going to do is I'm going to be assessing her neck. And I'm going to start by assessing her carotid for amplitude. I'm going to do it bilaterally. And then I can even listen to her carotid with the bell of the stethoscope and identify any bruits that might be present. Then I move my focus towards her ear. And I'm just going to look at her ear, and I can do the hearing test, the Webers, the Rhines, finger rub test. Good. Okay. Then I'm going to move towards her eyes, and I'm going to use a pen light, and the first thing I'm going to do is check her corneal light reflex. I'm happy to just look straight ahead. Good. Pupillary response. Good. Next, we're going to check accommodation, and what I want you to do is identify something on the wall back there, and shift your gaze on that. Keep your gaze right there. Then I want you to shift and look at my finger right in front of you, and then back towards the wall. Good. And I want our pupils to be round, reactive to light, and equal. And this, I can also do a couple other tests. I can do her extraocular muscles, her cardinal fields of gaze. I can do a confrontation test and a cover-uncover test, checking for nystagmus if we needed that. Next thing I would do is I would also assess her brachial pulse, and I would do her reflexes. Good. I would check her capillary refill, and I'm going to have you squeeze my finger as hard as you can. Good. I'm going to have you lift your shoulders up against my resistance, shrug up, and then come back down. Good. Next thing I would do is check her neck range of motion. I'd have you rotate, look all the way over at the wall, all the way back to the other side. Good. Up, down, come back to the center, and then right, and then back to the left. Good. Any pain with any of those motions? Very good. Okay, next thing we would do is we would move towards her nose, and I'd ask her if she could breathe okay through her nose. Good. I'd include one nostril at a time. I'd ask her to take a big, deep breath. Good. And we'll do the other one. Good. I feel her head and her sinuses. And I'm checking for the symmetry of her facial bones, seeing if her ears are in line, if her eyes are lined up together, and if she had any pain when I was palpating those sinuses. Okay, now we're going to shift our focus towards her breath sounds. Big breath. Let it go. Big breath. Let it go. Okay, you just breathe normal. big breath and blow it out. Good, and again, big breath and blow it out. Good. Okay. Resonance is the sound I'm going to be hearing throughout her lung fields. I'm going to ask you to take a big breath and say 99.
99.
Say it again.
99.
Say it again.
99.
And say it again.
99.
Good. Right. Have you lean forward and touch your toes for me? Good. I'm just checking for spinal alignment. Good. And come back up. Very good. And just feeling for any tenderness, any lesions that might be there. I'm looking for any masses. Straight away. Finish listening to her breath sounds. Listen to her heart. Okay, what I'm going to have you do is, again, say 99.
99.
99.
99.
Good. 99.
99.
And one more.
99.
Good. What I'm going to have you do is lie back on your back for me. There you go. Good, now we're going to start the abdomen examination. And this client doesn't want her abdomen to be exposed, but normally I would look at the abdomen exposed and I would look to see if the umbilicus is in the midline. I would check again for lesions, any type of tone, temperature of the skin, and identify any masses. And I look at the aorta especially to see if there's any amplitude there. And next thing I would do is I would listen. Symphony is the primary noise I'm going to be hearing throughout her abdomen. And what I'm going to do now is I'm going to check her pulses and her extremities, femoral, dorsus pedius. Check the capillary refill in the extremities. I'm going to have you flex your fingers, your toes down and then up for me. Good. I'm going to check for sensation. You feel that. And reflex. There you go. It's there. Good. What I'm going to have you do is flip all the way over on your stomach for me. I'm just going to do a few quick tests here for the low back pain. I'll let me know if you feel any discomfort or pain here. I'm going to be lifting your leg up, putting a little pressure into the lower back. Any pain here?
No.
Good. Any pain here?
No.
Good. Bring this toe to the opposite hip. Any pain here?
No.
Good. And finally, I'm going to bring this leg up. Any pain here?
No.
Good. And while she's here, I can also check for the popliteal pulse. Good. Excellent. Okay, have the patient turn over on her side and use her arm and elbow to push herself up and swing her legs around. And that would conclude my head-to-toe assessment of a patient with intermittent headaches and low back pain.